And moving on to our last story for today, the deadly Ebola outbreak in the Democratic Republic of Congo has put the world on high alert. The World Health Organization is sounding the alarm over the new outbreak. The virus is spreading rapidly in the DRC.
On Sunday, I declared a public health emergency of international concern over an epidemic of Ebola disease in the Democratic Republic of the Congo and Uganda. This is the first time a Director General has declared a PHEIC before convening an emergency committee. I did not do this lightly. I did it in accordance with Article 12 of the International Health Regulations after consulting the Ministers of Health of both countries, and because I'm deeply concerned about the scale and speed of the epidemic.
So far, there are 130 suspected deaths and more than 500 suspected cases. The epicenter of the outbreak is the DRC's northeastern Ituri province. The area is a major gold mining hub. People move constantly across the region, which makes tracking the virus incredibly difficult. Even worse, cases are now popping up hundreds of miles away. Suspected cases have been reported in the commercial hub of Butembo in the neighboring North Kivu province. Another case was recorded in Goma, which is a key provincial capital. The virus has already crossed borders into neighboring Uganda, where the government has banned handshakes to stop the disease from spreading further. Rwanda, too, has closed key border crossings with the DRC and has stepped up health screening at the border.
So far, 30 cases have been confirmed in the DRC from the northern province of Ituri. Uganda has also informed WHO of 2 confirmed cases in the capital of Kampala, including 1 death among 2 individuals who traveled from DRC.
Health workers are facing a nightmare scenario on the ground. This is the DRC's 17th Ebola outbreak. It is hitting areas torn apart by long-running conflicts. Goma is currently controlled by the M23 rebel group. The active frontline runs right through the outbreak zone. The International Committee of the Red Cross warns that fighting could completely block humanitarian access. They are urging all armed groups to allow health teams to do their jobs. There is another major challenge. Scientists say that this outbreak is caused by the Bundibugyo strain of Ebola. It's unlike the more common Zaire strain, and there is currently no approved vaccine or therapeutic treatment for the Bundibugyo strain. The WHO is urgently reviewing candidate vaccines to see if any can be used. Now, this specific strain has a mortality rate of up to 50%. Public fear and misinformation are also slowing down the response. Congolese Health Minister Samuel Roger-Kamba stated that the alert was slow to circulate. Many people initially believed the sickness was a mystical illness. Because of this, many sick people did not go to the hospital. Officials stress that the current death toll of 131 includes community deaths that are not yet laboratory confirmed. Because the region is so remote, very few samples have actually been tested. The Africa Centers for Disease Control and Prevention has declared a continental public health emergency. Meanwhile, the virus has also hit an American aid worker. A doctor working for a Christian NGO was exposed to the virus. Germany is currently preparing to receive and treat that doctor. U.S. President Donald Trump says that he is concerned about the Ebola outbreak.
Go ahead, Ebola, you said Ebola.
Yeah. Should Americans be concerned about Ebola?
I'm concerned about everything, but certainly am. I think that, it's been confined right now to Africa, but it's something that has had a breakout.
In response to the threat, Washington has urged Americans to not travel to the DRC, South Sudan, and Uganda. The United States has announced it will start screening air passengers coming from the affected areas. It has also temporarily suspended visa services in the region. Ebola was first identified half a century ago, back in 1976. It is believed to have originated in bats and spreads through direct contact with bodily fluids. It causes severe bleeding and organ failure. The DRC's deadliest outbreak occurred between 2018 and 2020, claiming nearly 2,300 lives. Congolese President Felix Tshisekedi is urging citizens to remain calm and to take strict precautions. Meanwhile, the WHO is holding emergency meetings to coordinate a global response. We will keep bringing you the latest updates on the outbreak as they arrive.